Hello, my name is Dr. Aslie. I'm a board-certified fellowship-trained spine surgeon. I'm the medical director here in Sacramento Spine Treatment Center. In this segment, I would like to talk to you about a procedure called radiofrequency ablation and facet blocks. It's a very commonly performed procedure for low back pain that's coming from the facet joints. Now, let me brush you up on some of the anatomy. This is a model of the lumbar spine. As you can see, lumbar spine is composed of 5 vertebrae stacked up on top of each other. The vertebrae connect to each other up front through this disc, which is a cartilage, which is a shock absorber, which gives flexibility to the lumbar spine. But through the back, the vertebrae connect to each other through these gliding joints. We call them facet joints, and they are covered with cartilage. Now, these joints, just like any other joint in the body, can wear and can get damaged. And if they do, they can cause pain in that location. It's very difficult to see on the studies like X-rays and MRIs and a CT scan. And the way to diagnose it is basically to put numbing medication in that area and see if that pain goes away. That's the facet block. Now, let's say that we are suspicious of facet joint being the source of the low back pain. At that time, I send my patients for facet block. Now, this procedure is a diagnostic/therapeutic procedure. Why? Because it's therapeutic. It can take away the pain for a good time. And even if the pain goes back, even if it helps just a little bit, it tells me that the facet joint is the source of the problem. Therefore, it's a diagnostic test as well. Now, for the facet block, patient comes in, lies face down, and under X-ray, a needle is placed into the facet joint. And at that point, we inject numbing medication and some steroids to calm the inflammation. Very simple procedure, very safe. The same day patient goes home, and then we'll see how the patient does. If the patient does get relief even for a few hours, that means the joint is the source of the problem. Now, if the pain goes away with some anti-inflammatories, with some steroids, then we're all happy. However, if the pain comes back, then the next step is to do radiofrequency ablation. Now, we do that only if patient has a positive response to numbing medications into the facet joint. Now, I would like to direct your attention to this model right here. This is a cross-section of spine. As you can see right here, this is a vertebral body with a disc, neural arc, lamina, and you can see the spinal cord in the middle. And these, what you see on both sides, are the facet joints. As you can see right here, the nerves are exiting spinal cord and neuroforamina. And a very small nerve right here, as the nerve root exiting the canal, it branches off and it turns around and innervates the facet joint. Now, as you can see this in this model, you can't see the nerves, but the main nerve comes out of this hole and it goes down to the legs. But a very small branch turns around and innervates this facet joint. Now, if we've done facet block and we've had positive response, that means that we injected the numbing medication into the facet joint and that took the pain away. We know that that facet joint is the source of the pain. Therefore, if we deactivate the nerves that innervate that facet joint, that should take the pain away. Now, that is radiofrequency ablation. The way it's done is that the patient comes in, face down on the table. Under X-ray guidance, a probe is placed right lateral to the facet joint, right at this gutter right here, where the nerve comes in. And with radiofrequency, we deliver heat. Basically, you burn the nerves that are innervating the facet joints. Only. Just the nerves that they go to the facet joint. And that should help the back pain significantly. It's a very safe procedure, but the problem is that those nerves don't stay that way. They grow back. Therefore, chance of radiofrequency ablation helping the patient is good, but it lasts about 6 months. And if the pain comes back, we can always repeat the procedure. Because why? Because the alternative to it, a permanent solution, would be probably a fusion surgery to stop the joint from moving, which is absolutely the last resort. I hope you enjoyed this segment. Have a nice day.